Okay. Are you able to see me? Because I'm not able to see myself. So I think I am not able to see myself. Okay. 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 Right, guys. So let's have quick recall. I'll not waste much of your time. I know all of you are exhausted after a long day today, and all of you are tired. All of you have done whatever was supposed to be done. It's over. So the only purpose of this is basically that you should be well versed with the questions. That's the only purpose of this. Nothing more, nothing less. So with that, let's quickly start up the recall question. I will not waste much of your time, and I want you all to sleep nicely today. So starting with the first one, I posted some of the questions on my Insta itself. Least common finding in the diabetic kidney. In fact, it was glomerular, which is the least common finding in the diabetic glomerular lesion. You have to be very clear that Armani-Epstein cells are usually not seen. Armani-Epstein cells are basically seen in the tubules. Okay, all the other findings are seen in diabetic kidney. The earliest finding is one of the podocytopathies. So remember, podocyte loss is a common finding in the diabetic kidney. Mesangial winding and adding of the glycogen leads to your nodular glomerulosclerosis, which is also called as Wilson lesion. And basement membrane thickening is one of the earliest findings. So that's correct. Okay. So the answer is Armani-Epstein, which are glycogen-orate cells in the proximal convoluted tubule. It's not a common finding in the glomerular disease, and it's one of the last later findings which comes. Okay, so it's not a finding in the glomerulus. Coming to the next, alleles of the gene pool belongs to, it's always population. Okay, gene pool always belongs to the population. Remember, whenever we talk about the individual, it's a genotype. Like in gene pool is always of the population. Okay, so there were multiple lytic lesions on the skulls that were given. Remember, multiple lytic lesions are usually seen with follicular carcinomas of the thyroid. Follicular carcinomas, I myself have seen 2 cases with this. Okay, so they produced multiple lytic lesions in the skull, and this is common with follicular carcinomas. So, which gene militant patient is poor was given, the family history was given. Basically, the most important question. There are various versions of the recall of this question. The point of this is some of the students said that there were calcifications which were also given. So the purpose of this question is just to tell you that you have to do the genetic testing for the inherited breast cancer genes, that is BRCA1 or 2, whatever was given. Okay, why not P53? Because P53, although it is called as Lee-Fraumeni syndrome, you all know that, but P53 is not specific for breast cancer. P53 is one of the most common cancer which is mutated in sporadic cancers. It can be mutated in any sporadic cancer. That's why it's not specific. P10 is basically your Cowden syndrome. It has breast cancer, but again, it's not specific. Okay. CDH1 is basically with lobular carcinomas, and if they have given you calcifications, and the image was histopathology was also given, and it was not Indian file pattern. So that is why this was out. So the best answer here would be BRCA genes, which you should go for. So what is not observed in Turner syndrome? I hope everybody marked it correct. Short metacarpal, web neck, wide nipples are characteristic feature. Prominent occiput is basically seen in Edwards syndrome. So that is why it is not a feature of Turner's. BRCA testing technique, this we had already discussed in the genetic technique YouTube video. And if you've heard that video well, you would be knowing that southern blots basically are used for DNA, specifically for deletions. Okay, so we don't do it here. qPCR is basically real-time PCR, which is used for quantification. So whenever we talk about quantification, like CML को therapy दे रहे हैं, उसको follow up कर रहे हैं, then you do qPCR, not for BRCA. RT-PCR से also we cannot pick up the BRCA mutation. So to pick up BRCA mutation, the best is targeted mutation testing or whole exome sequencing. Whole exome sequencing will also help to identify the unknown BRCA point mutations which might be there. So that is why the best technique here is whole exome sequencing, which everybody should be very clear with. Okay. Coming to the next, this is incorrect association. All of you know. So whenever you are in doubt, always choose the answer which is definitely not correct. Okay. So mucosal neuromas are not seen with P53. You know that P53 is Lee-Fraumeni syndrome. It can be associated with brain, breast, and sarcomas, not with neuromas. Neuromas is not a feature of P53 mutation. Apart from that, STK11 is basically Peutz-Jeghers syndrome, but it can be associated with breast and sex cord stromal tumors. Okay, so that's correct. P10, you know that I bet this is a cow. So breast, endometrium, and thyroid. That's correct. BRCA2, we have talked about this so many times, between difference between BRCA1 and BRCA2. I've been telling you so many times. That PPM, you should remember, prostate, pancreas, and melanomas are typical association with BRCA2, which you should always remember. So that is why this is a correct association again. Okay. So caspase 1 mediated cell death, everybody knows that this is nothing but pyroptosis. Caspase 145 is with pyroptosis, which you should remember, and it is basically associated with fever. And these, the main cause of fever in this is interleukin 1, right? So which is not an aneuploidy. What do you understand by aneuploidy? Or aneuploidy means 2n plus 1. So whenever there is an equal increase in the number, this is aneuploidy. So any trisomy, whenever we talk about any trisomy is aneuploidy. Okay. So it is trisomy 13, trisomy 21, or any change in the chromosome number is an aneuploidy. Bloom syndrome is not an aneuploidy. Okay, so it's a DNA repair defect. It's a genetic defect. Okay, gene defect. It's a single gene disorder. When we talk about aneuploidy, we're talking about chromosomal disorders. So when we talk about chromosomal disorders, we have chromosomes which are abnormal. Bloom is a DNA repair defect. Okay, so it's a gene defect. Okay, so that's why it's not an aneuploidy. Most common inherited bleeding disorder, I've told you so many times this is von Willebrand deficiency. But why is it not symptomatic? Is why it's not commonly known, because it's not symptomatic. Most common type of von Willebrand deficiency is type 1, which is not symptomatic. So that is why we don't know it much. So if they change the question to most common symptomatic bleeding disorder, then the answer will change to hemophilia. So the answer to this question is A, that is von Willebrand deficiency. In which condition erythropoietin will be useful for the treatment? This again we have discussed on my Instagram. I posted this. Erythropoietin is very, very useful for patients in which the bone marrow is functional. And when bone marrow is functional, you just have to give erythropoietin, and the bone marrow will start working and it will be starting releasing molecules. Okay. So this is specifically true for chronic kidney disease. So whenever patients have chronic kidney diseases, in such diseases, erythropoietin is very useful. Now, what about myelodysplastic syndrome? So this also I've told you, whenever we have low risk myelodysplastic syndrome, then we can give this. So if it was a multiple choice question, then A and B should be the answer. But if it is not multiple choice question, then A is definitely much more than B. Okay. Now, what about nutritional anemia? Nutritional anemia is due to deficiency of nutrients. If it's an iron deficiency anemia, you have to give iron. If it's B12 deficiency anemia, you have to give B12. So they will not respond to erythropoietin. Aplastic anemia में तो bone में कुछ है ही नहीं, bone marrow खाली है. So even if you give erythropoietin, nothing is going to happen. So therefore, the answer, if you want to have to ask mark one answer, then it should be A more than B. Okay. Okay. Very good, Abdul. Perfect. That's what I'm saying. So if it was a multiple choice question, then A and B both should be the answer. So because in A also we can give, in B also, myelodysplastic low risk also we can give erythropoietin and it is effective, but not in C and D. So C and D में नहीं दे सकते. Okay. And if it is asked as a single answer type, then A is definitely more than B. Okay. So that is how you should always choose the options also. Learn to remember INI-CET questions in this way, that it can be given to you as a multiple choice question also. So remember that point always. Okay. Okay. Let's come to the next question. Hi. Hello, Achan Khan. So that's perfect. So let's understand this. This was a question in which patient had chymosis and increased megakaryocytes and the platelet count was decreased. So definitely this is looking as a case of ITP. So whenever a patient has immune thrombocytopenia, it depends upon whether the patient is bleeding or not bleeding. If he's not bleeding, we'll give steroids. If the patient is bleeding, we will give IVIG. Why? Because it's an immune disorder. You have to block that antibodies. So that is done by IVIG. So that is what should be the next line of treatment. That is always IVIG. We don't do bone marrow examination in ITP, and FFP has no role, aspirin has no role. Okay, so IVIG is the perfect answer here. Now, this was something which is very important and catch point question. So this was glucose 6-phosphatase. I don't know, this is a spelling mistake or what is this? I don't know. So if it is glucose 6-phosphatase deficiency, then it is a type of glycogen storage defects, especially type 1. In such cases, we will have problem in the liver. So whenever there is a problem in the liver, so some amount of direct bilirubin can be increased. Okay, and other things, indirect bilirubin, urobilinogen, urine bilirubin, everything will remain normal. So if it is glucose 6-phosphatase that is given, then the answer should be C. That is, bilirubin direct is raised, normal indirect, and absent urine bilirubin. Remember, urine bilirubin will always comes whenever there is a conjugated hyperbilirubinemia. So whenever there is very high conjugated hyperbilirubinemia, it will start coming in the urine. But in cases of the glucose 6-phosphatase deficiency, then in such cases, your bilirubin will not come in the urine, and urobilinogen to aa hi nahi sakta. Urobilinogen will come in the urine whenever there is an indirect hyperbilirubinemia. Suppose I change the question to G6PD deficiency. Suppose if it is G6PD deficiency, so remember G6PD deficiency is a hemolytic anemia. So in hemolytic anemia अगर हम बोले तो hemolytic anemia में indirect bilirubin बढ़ जाता है and urobilinogen is also increased. Okay, so in such condition अगर G6PD deficiency देते तो हमारे पास indirect bilirubin बढ़ता, direct bilirubin normal रहता, and urobilinogen भी increase हो जाता. But if it is a glucose 6-phosphatase deficiency, which is a glycogen storage disease type 1, then only direct bilirubin will be increased, your indirect bilirubin will remain normal, your urine bilirubin will also remain normal, your urobilinogen will also remain normal. So that is what you have to be very, very clear with. Okay, so that is about glucose 6-phosphatase deficiency, which all of you should be very clear. Now, this was a recall. This was a question which we have discussed in the GTs also. So, this is neutrophilic granulomatous mastitis. So, remember, this is typically caused by cornybacteria, crop and steady. So, this is the typical organism. What about cornybacteria minicutum? This typically causes erythema, okay, which is a skin condition. Okay, which is a skin condition. TB, Mycobacterium TB very rarely causes granulomatous mastitis, or agar karwata hai, तो it is never neutrophilic. So here the catch point was neutrophilic. So that is the discussion point also we have discussed here also. Neutrophilic granulomatous mastitis, which is a typical catch, simple question which has been taken from Robbins. It's taken by Cornybacterium crocostedi. Look at this, malignancy which is unrelated to obesity. So remember, it is always stomach. Okay, so stomach malignancies are not related to obesity. Pancreas mein hota hai, meningioma mein hota hai. In fact, in multiple myeloma also, they say whenever the patient has obesity, this causes inflammation, and inflammation alters the immunity, and that is why it can cause multiple myeloma. So stomach malignancies are not related. Stomach malignancies are not related to obesity. Okay, so so there was a histopathology and gross of the granulosa cell tumor. This was also a multiple choice option. So here connexional body hoti hai, inhibin hota hai, coffee bean nucleus hota hai, CA125 nahi hota. So if you start searching on the net, then they will say CA125 rarely can be positive. So I don't know what is the key with the examiners. I don't know, but majority of the time when we study that CA125 is typically elevated in cases of surface ovarian tumors. So surface ovarian tumor ke liye hum bolte hain. Whereas granulosa cell tumor, so these belong to sex cord tumor. Sex cord tumor mein CA125 positive usually nahi hota hai. So that is the point. So I don't know what is the key of the examiner, but most of the time, remember CA125 is a marker for surface ovarian tumor. So if I have to choose the answer, I will say A, B, and D. That will be my choice of answers. Okay. Now, this is a renal transplant biopsy to stain organism, which stain is not used to identify the organism. And some people told me that aspergillus was given in the questions. Okay, so basically the point is, so whether it is a parasite, whether it is a fungi, gomorymethamine is used for fungus. Okay, for fungi we always use gomorymethamine. For PAS always is very beautiful stain used for fungi. Now you would be caused between two stains, that is Masson Fontana lena hai ki Congo red lena hai. So Congo red has only one use in your body, that is to pick up a myeloid. Okay, so that is to pick up a myeloid. It is never used to identify any parasite or any organism. What about Masson Fontana? Masson Fontana is actually a stain for melanin. So whenever you have diatomaceous fungi, pigmented fungi, they can be identified by Masson Fontana. Okay, so Congo red is never used to identify any organisms. So that is the best answer that has to be chosen in such situations. Now let's do simple match the following. You know the code. South people eat dosa. Okay, North people would eat roti, and protein should be used for increasing weight. So that was a simple match the following, and I am sure all of you did this correct. So next question was why H. pylori does not present with ulcers. So H. pylori doesn't present with ulcers. You have to remember this is because of host factors and the environmental factors. So there are there are a lot of host factors. So some in some patients there is less alterations in the pH. Apart from that, environmental factors also play a role. Apart from that, the virulence of the H. pylori also plays a role. That is a major role for ulcer detection. So that is first. What about this? So increased risk of peptic ulcer disease when H. pylori is with NSAIDs. That is true, but it is not the cause of ulcers. H. pylori infects the antrum even in asymptomatic individual. That is also correct. That is also correct. But then again, this is not the cause of the ulcer. H. pylori patient majority are asymptomatic. That is also correct. But again, it is not the cause of ulcers. So if the patient is presenting with ulcer, that it is related to host factors, environmental factors, and the virulence of the H. pylori. So these are three major factors that relates why some H. pylori presents with ulcers, some people with H. pylori present with ulcer, and some people do not. So this is basically due to host, environment, and the virulence of H. pylori. That should be the answer. Again, a tricky question. I know it's a tricky question because all the other options are also correct. But yes, option one, which is more correct for causing ulcers. Now, transplant rejection does not occur with, again, this is a very close option. Transplant rejection does not occur with SCID because SCID doesn't have T cells. On T cells and B cells भी नहीं होते हैं, तो reject कौन करेगा? So normally our T cells basically are the main people who are basically attacking and rejecting. B cells are also making antibodies and rejecting. So when there are no T cells, no B cells, there will be no transplant rejection. Now what about Bare lymphocyte syndrome? So Bare lymphocyte disease is a disease in which there is no MHC2. So when there is no MHC2, obviously there will be no antigen presentation. So when there is no antigen presentation to the T cells, obviously rejection के chances बहुत कम हो जाते हैं. So it goes in that order. The SCID, if it was not a multiple choice, SCID will never reject, followed by Bare lymphocyte syndrome. Okay, chronic granulomatous disease is a defect of the phagocytes. So इसमें rejection होगी because phagocytes have no role in rejection. Okay, so transplant rejection does not occur in SCID should be the answer. If it is one choice answer, if it is tomorrow asked as a multiple choice answer, so SCID और Bare lymphocyte दोनों में rejection नहीं होती है. Okay, but SCID comes on the top, जिसमें rejection कभी नहीं होती है, followed by Bare lymphocyte disease. Okay, right. Now this was a jinx question. Okay, right. So whatever was it, so that is why I told you that is how you should go by. So that is why Cybor, I told you that is how you should go. If SCID was not in the option, then Bare lymphocyte, because in दोनों में rejection नहीं होती है. Okay, so that is why I'm always telling you follow this order always. This, if it is one choice answer, you have to mark that answer. If it's a multiple choice, at least can be the answers. That is why I'm telling you like this, because many of the questions were multiple choice questions in this time in INI-CET. This was my jinx question which I had given you yesterday. It's also one of the recall questions or earlier questions in which this was done. I hope you have not marked this wrong. Terminal bronchiole has well-defined columnar epithelium, which you can see, whereas respiratory bronchiole usually has a flattened lining, and most of the time it is surrounded by alveoli, because terminal bronchiole is a conducting passage. So I tell this to my students all the time, that the terminal bronchiole is always the conducting one. So when it's a conducting one, then it will only have columnar cuboidal epithelium. It will not be surrounded by alveoli, whereas respiratory bronchiole is an exchange system. So here alveoli will always be surrounded. It has a flattened epithelium and alveoli is being surrounded. So whatever was masked, I think most of the students told me respiratory bronchiole, so I'll go by that. Okay, Cybor. Cybor is telling that here the answer options were Wiskott-Aldrich syndrome and E was Chidiac-Higashi syndrome. So if it was Wiskott-Aldrich and Chidiac-Higashi Cybor, you should remember, then इसमें भी rejection होती है. Okay, so therefore Bare lymphocyte में rejection नहीं होती. Okay, right. Let's go to the next question. So what explains the cancer cell consuming more oxygen than the normal cells? So cancer cells require more lactate production, and that is why they have more glucose consumption, they have more lactate production, and they always prefer glycolysis even with the oxygen present, because for their faster growth and biosynthesis they require glucose. So they're very glucose hungry, and this effect is called as Warburg effect, and PET scanning is based upon this technique. Okay, so this was an antibody that was given. It is a dimeric antibody. You can see that both the FC regions of the antibody are joined at the are joined with J chain, and it's a dimeric antibody, which you can see here. Dimeric antibodies is always IgA antibody, and that should be very, very clear. Okay, going to the next question here. So what is this and technique involved? This I have discussed a video on my Instagram channel also, just showing you the video which you all of you should be
many of you wouldn't have heard about at all. So what was this question and what is this technique? So this was called as surface plasmon resonance. What do you understand by this? Surface, surface. Plasmon means the electrons which are oscillating, and because they are oscillating, the resonance is going to change of the surface area. So what do we do in it? So ये आपका एक surface है. So this is a gold-plated surface. So when it is a gold-plated surface, so now pass a light on it. So this light is a polarizing light which comes through the prism. So when it comes on it, so definitely it will cause the electrons which are there in surface to resonate. Okay, oscillate. Okay, so that will happen. So now what we do is we bind the antigens over the surface. So ये gold-plated पे हम antigens लगा देते हैं. So now once the antigens are on the surface, the light is going to pass. Okay, so that is normal. Now what do we do if we want to study the antigen antibody interaction? What do? We add a tube over it, and from the tube the antibodies are passed on. Now the question is, so now once the antibodies are passing, so what will happen in?
Now the question is whether it is an affinity or is it a concentration. That is what you have to be very, very clear. Okay, so remember, it is always affinity more. Okay, it tells you the affinity more than the concentration. So that is one thing which you have to be very, very clear. So it is always affinity more than concentration. So that is the main purpose of this technique. So this is surface plasmon resonance. It tells you affinity more than the concentration, and also you have to tell okay. So Achan, now you can hear me. Now it's better, I think. So basically what happens is surface plasmon. So you can go and hear this video on my Instagram. I've already posted it. So the only purpose of telling you this diagram is that this is the surface. Yes. So this is the surface, and we have antigens which are bound here. So as soon as we pass the light, there's a reflection of the light which is there in one point. Whenever the antibody binds, then again electrons will oscillate at a different level, and you will again get a reflection of the light. So this is called resonance unit again. So this resonance units are basically detected by surface plasmon resonance technique. So the beauty of this technique is you don't need any color binding or binding substance. So just do antigen antibody reaction and it detects it. Okay. Now the beauty is that this technique basically identifies the affinity of the binding of antigen antibody rather than concentration. It tells you the concentration also, but more importantly, it tells you how much affinity is there between the antigen and antibody. So more the affinity, more the oscillation, more the resonance units. Okay. So that is the beauty of this technique. This is called a surface plasmon resonance affinity methodology. The technique is surface plasmon resonance, and it basically measures the affinity. So that has to be very, very clear to everyone, right? Okay. So that's a graph.
Okay, which many of you wouldn't have heard about at all. So what was this question?
So that's a graph. So whenever first only antigens are there, it's plateau. So whenever antigen antibody reaction comes, it gives a peak like this. Okay, then उसके बाद क्या होगा? उसके बाद एक plateau आ जाएगा, and then when you add the buffer, the antigen antibody gets separated, it will fall down. Okay, so that is how we get this curve. That's a curve of surface plasmon resonance. Okay, coming to the next, HLA mismatch transplant is not a problem in. So it's HLA mismatch transplant is not a problem in bare lymphocyte syndrome. Why? Because even if you're giving a mismatch transplant, bare lymphocyte syndrome do not have MHC2. So when they do not have MHC2, so there will be no presentation of antigen presenting cell to the T cells. So even if you give mismatched HLA, nothing is going to happen, because even if there is some different cell with different HLAs coming, your MHC2 is not going to present it to the T cells. When it is not going to present to the T cells are not going to react. Okay, so this is HLA mismatch transplant is not a problem in bare lymphocyte syndrome. Scott Aldrich, Jobs, Chidiakigashi, all of them will have a problem with HLA mismatched. Okay, so bare lymphocyte syndrome is a condition where HLA mismatch transplant is not a problem. So these are the 25 questions that I could get from the recall of your INI-CET questions, guys. I hope all of you did these questions correctly, and even if you didn't did it correct, it is okay. Celebrate the win. Even if your 1 or 2 questions are wrong, it doesn't matter. Remember, these small setbacks is a part of your growth, and it will make you better trained for future. Be consistent. ऐसा नहीं कि INI-CET is finished, so I should not, because NEET PG is very close by. So be consistent. Take a break today and tomorrow, but start from Tuesday. Be consistent and start from now. Okay. And apart from that, you have to remember, you have to stay curious. On the rocks, so that was another question. Thanks for telling me this. Yes, so I have missed that question. Yes. So, but in that question, mental cakes were given. So whenever they give you a history of mental cakes with a very high CA125 of more than 900, more chances of carcinoma should be there, and it is mucinous in type. So it could be mucinous cystadenocarcinoma, which can be there, which can present with the ascites also. So that was another question. Yes, thank you for telling me that. Okay, so yes, perfect, right? So that is your mucinous, which you should be very, very clear with. Okay, so perfect, thank you. And yes, so this is my Instagram channel, guys. You can stay tuned for more updates, and I keep posting some good questions. Yes. Serous does not usually present with cyst. Omental cakes to बिल्कुल नहीं होते. Omental spread is more commonly seen in mucinous. That is why mucinous is a better answer to this. And they had also given you multiloculated lesion. So that is another pointer that has to be given. Yes. So that is why I will prefer the answer as mucinous. Right? Correct, guys. So with that, shall we close this session? If you have any doubts, I'll be happy to take. Yes. So there were 4 techniques this time in pathology. I know the pathology questions. So questions were tricky, definitely. And I know because there was a lot of multiple choice questions, which were multiple options, which were given, that it was difficult to predict how well you have done. But believe me, AIMS result is always a googly. You will be surprised to see the results at the end. So wait for your results. Okay, but since your exam is very clear, very close, NEET which is very close, be consistent. Maybe that you are topper in both the exams. Yes, so why to lose that opportunity? Don't lose the opportunity and keep studying well. So with that, good night, guys. Sleep well today. It has been a long day, and sleep well. Bye bye, guys.